Yeah, hi everyone. Welcome to my YouTube channel. My name is Dr. One, and I'm here today to talk about anemia. So the title goes as follows. What is anemia? Anemia is a condition characterized by a decrease in the total amount of red blood cells known as RBC or hemoglobin HB in the blood, leading to reduced oxygen carrying capacity. Now, anemia is actually classified, so we now look into the various types. So classification of anemia, we have one based on RBC size, that's MCV, which stands for mean corpuscular volume. Microcytic anemia, MCV, which has less than 80 FL. In that case, we do have iron deficiency anemia, thalassemia, anemia of chronic disease, or which is not that random. And then we have sideroblastic anemia. Then we do have normal cytic anemia, MCV, which is 80 to 100 FL. In that case, we have acute blood loss, hemolytic anemia, anemia of chronic disease, and aplastic anemia. Then we have macrocytic anemia, that's MCV, which is greater than 100 FL. And in this case, we have vitamin B12 deficiency, folic acid deficiency, alcoholism, liver disease, hypothyroidism, myelodysplastic syndrome. And then now we need to look at the etiology. Etiological classification, we have blood loss, acute trauma, chronic GI bleeding, menorrhagia. Then we do have decrease in RBC, which I said stands for red blood cells production. Nutritional deficiencies, in which in this case there's that lack of iron and B12 and folate. Bone marrow failure and chronic diseases. Then we have increased RBC destruction, which is common in hemolytic anemia, hereditary spherocytosis or G6PD, acquired autoimmune. Common symptoms are fatigue, weakness, pallor, skin conjunctival or conjunctival, dysphagia, palpitation, dizziness, pica in iron deficiency, neurological symptoms in vitamin B12 deficiency. And then we have now lab values that can be conducted. So lab diagnosis of anemia. So we start with number one, complete blood count, CBC. Hemoglobin, HB low in anemia. Hematocritic, that's HCT, usually reduced. RBC count, which is decreased. MCV helps classify anemia into various classes. That could be micro, normal, and macrocytic. We do have the MCH/MCHC assessed hemoglobin content per RBC. Then we have RDW, red cell distribution width, increased in mixed or iron deficiency anemia. Then we move now to number two, which is peripheral blood smear. Morphology of RBCs: microcytic, hypochromic, that is iron deficiency, macrocytic, megaloblastic, spherocyte, schistocyte, hemolysis, target cell, that's thalassemia, hypersegmental neutrophils B12 slash folate deficiency. And then we have the third one, which is reticulocyte count, indicates bone marrow response, low in production defects, high in hemolysis or blood loss. And number 4, iron studies. Serum iron, low in iron deficiency. Then we have the TIBC, which stands for total iron binding capacity, increase in iron deficiency. Then we have the ferritin, low in iron deficiency, high in anemia of chronic disease. Then we have transferritin, saturation, low in iron deficiency. And then the fifth one is vitamin B12 and folate level, low in megaloblastic anemia. And the sixth, hemolysis workup, LDH increased, indirect bilirubin increased, haptoglobin decreased. Then COM test, positive in autoimmune hemolytic anemia. And 7, bone marrow examination. If diagnosis is unclear, or for aplastic anemia, leukemia, then we have now erythroid hyperplasia in hemolysis, or megaloblastic anemia. And 8th, special test in this case, which is HB electrophoresis. And in that case, we need to do that for thalassemia, sickle cell anemia, G6PD-AC, G6PD deficiency, osmotic fragility test, hereditary spherocytosis. Treatment overall in this case is for iron deficiency, we will need to recommend oral or IV iron. Then we have the B12/folate deficiency, which in that case you need to get some supplements. And for hemolytic anemia, treat underlying cause. Steroids could be used, and then transfusion. Chronic disease anemia, in that case we have same thing, managing the underlying disease. And then severe anemia, which is blood transfusion if the HB critically low. So far so good. By the way, I'm not a hematologist, so get it clear here. I'm just trying to simplify things for my students. Thank you. And once more, my name is Dr. Wan. Thank you, and do share this information with others. Bye. Ciao.